सर सामने
हाँ गोविंदा
थैंक यू
অন্য লোকে আছে তারা অন্য লোকে সুযোগ দাও
थैंक यू
Today we've got a list of distinguished guests on our podium who are going to enlighten us on why the aorta is the next latest organ. I would not take too much of your time and would request Dr. Atanu Saha to please take the conference forward.
Thank you all for joining us here. We have a very distinguished panel of guests who have come all across India and abroad to share knowledge on aortic surgery. Aorta, as we all know, is the latest organ. So it has been classified as an organ from March 2024. Now taking forward, this is a second aortic conclave that we are having in the Eastern India. The first one was at Durgapur last year. Now this conference will focus on diseases of the aorta. Diseases of the aorta, its diagnosis, its treatment, and all the modalities combined together, including surgical as well as the intervention part. So taking forward, I will just request Dr. Bashi to say some key words. He needs no introduction. He is a world famous aortic surgeon and he has been a mentor to many of us, including myself. So Dr. Bashi, please.
Thank you, Atanu, and thank you all for coming this afternoon. As we has already mentioned, aorta is the main tube which takes blood out of you. You can see the aorta being put there in the blood. It takes blood to the whole body, including the heart. So it is so important that the diseases in the aorta has to be addressed properly because it's all life-threatening. That is, if something happens to the aorta, the whole blood will be evacuated in 3 minutes time and you will die. Any disease. So there are different types of disease which occurs in the aorta. One is, where the aorta dilates. That is, it becomes bigger and bigger and bigger. Different places it can happen. And suddenly, like a bulge, it occurs. And like a balloon, it bursts, all blood will go. Wherever you are, even if you are in the hospital, you may not survive if you come at that condition. That is one. Secondly, when the aorta has three layers like if you take like that, 1, 2, 3 layers are there. So sometimes a patient with a high blood pressure or sometimes people with a family history of aortic disease, when the tube may be weak, so blood can enter the layer and it becomes weaker and it can rupture. You will 90% of the patients will die in the first 24 hours. It is a surgical emergency. Now that is coming to the disease. So there are so many other factors which can produce this problem. One is by birth. Sometimes the aorta may be very weak. This is called we call connective tissue disorders in medicine. That is malformation from people who are very tall, joint. Their tissues are very weak. They can have this dissection. Second is one of the major risk factors is smoking. People who excessively smoke and do have high blood pressure, they can get aneurysms. They can get aneurysm any part of the aorta from the beginning. They can have produced disease in the coronary arteries. It can develop blood vessels going to the brain. It can be affected. So what has happened in the last almost 30-40 years, as we all know, we have progressed, our country has progressed. Development of medical treatment is advancing. You see a lot of hospitals are opening up. Scans and scanning is one of the main things. Now, since the depth of the problem is very serious, we cannot just, we all have become experts in treating the disease. You understand? Because when I started heart surgery 45 years ago in CMC Hospital, Vellore, aortic aneurysm operation was a very big procedure. People surviving was a big news. Today, a patient dying after a heart operation is very big news. So all of us have improved together. All the surgeons in this country have got training abroad. We see videos like meetings like this with interact each other. Everybody presents their experience and we learn from each other. So all of us have become experts in treating the disease. Now you have to highlight to the people how you can diagnose it and how you can prevent the disease from happening. One is you have to say that the blood pressure is there, it has to be controlled properly. Smoking, Government has put stringent laws, still people smoke thinking they are going to live forever. They don't listen to their children nor their wives. They think when they suddenly comes with a problem only, they think, so it's better to avoid smoking completely. Tobacco in any form is bad. Secondly, when you have a problem, see like checkup, patients are having, those who have got family history of heart disease. So if you have got an aortic aneurysm in your family, you have got at least about 10 times chance of getting an aortic aneurysm. For example, your brother has an operation with aortic aneurysm. Better to get the family members treated. Checked. Now, CT scan is like X-rays, olden days. 40, 50 years ago when we joined medicine, X-ray, CT scan, we never heard it. In every new corner of the country, we have a CT scan. So, you have got a hypertension. People who are over 60, usually it appears in older age group. Those besides hypertension and smoking. Younger age group only familial weakness of the blood vessel wall presenting aneurysm. So people who are over 65 years or something will get a simple scan of the abdomen. It may cost 1,000 or 2,000 rupees. A chest X-ray, routine X-ray, aortic shortage. Yesterday also I had a patient who was totally asymptomatic and went for a little cold. The referring doctor took an X-ray and found the aorta is dilated. So simple test can detect it early. Detection is very important. When the size increases, the chance of rupture is very high. So detection is prevention is better than cure. So you keep on, you go to the doctor, you may not need operation, all cases. So when the size is small, doctor will say, okay, you come after some time, we will serially do this test and do this procedure and refer to the study. So the public should be made aware the importance of this disease, and especially in a country like India, we have got 1.4 billion population. We should be doing about 5 lakhs of aortic operations a year if you compare the statistics with the US or UK. So hardly we are doing maybe 1 lakh, about maybe 1,000 cases, 1,000 or 2,000 cases all over India, where we should be doing 4 to 5 lakhs per person. So the disease is already there, people's affordability is there, and we have people to treat and methods to diagnose this also. So the duty of the press is to inform the people. This is, don't take it lightly, avoid smoking. If you have a family history of all these things, you please have a checkup. It's like a mass level checkup when you are about 40 years of age. It is good. You may find out problems which you are unaware. Otherwise, you will be caught. Suddenly, you will say, oh, a patient has so-and-so had a chest pain. I saw him yesterday. Today he is normal. So all these are, majority of them are preventable, treatable with the expertise we all have. Everybody sitting here are experts in doing this procedure with a very good success rate, equivalent to any part of the world today. Thank you.
Thank you, sir.
Thank India after COVID-19, and I'm very happy to come back to India after 4 to 5 years absence. And actually, I truly respect Dr. Bashi and this pioneer in this field. So as a following generation, my curiosity is especially in open aortic surgery. So depending on the increasing population, especially India, and aged population is also increasing. So, but aortic surgery is very complicated. It requires a lot of organ protection. And we surgeons should know not only just heart, but also the brain protection, spinal cord protection, and organ protection. So in this setting, actually, if I can share my modest experience in Japan and Hong Kong, I'm very happy. Actually, I'm Japanese, but I'm now working in Hong Kong to share and establish open aortic surgery in Hong Kong. So after 7 years, I have some achievement in Hong Kong. So today, I'm very happy to share my progress in Hong Kong again in India. Thank you very much.
Thank you. Thank you, Dr. Fujikawa. I request Dr. Mrinalendu Das, our current head of the department of Aortic Hospital. Sir, could you just kindly share a few words?
So, as you have heard, that this is a very complex disease and needs a very urgent treatment sometimes. And these treatments are done only in specialized center, which needs a lot of backup, like blood bank, interventions, radiology, interventional radiology like Shuvro. So these are done in the peripheral, not much in the peripheral centers, but major centers, probably in Kolkata and other major cities of West Bengal. So if somebody has a chest pain, somebody is hypertensive and diagnosed to have aortic disease, they should quickly come to one of the specialized centers and get treated. The importance is to arrive early so that we can produce good results. Rest, of course, Dr. Bashi has focused. Thank you.
Thank you, Dr. Das. Next, I'll request Dr. Shuvro to say a few words. Diseases of the aorta right now can be treated surgically as well as by the endovascular means. So surgery and endovascular treatment goes hand in hand. So I'll request Dr. Shuvro to say a few words.
So I'll start off in English and I'll finish in Bengali because I think most of you here are from this part of the country and city. So as Atanu and Professor Bashi, very highly respected seniors of ours, has already mentioned, aorta is a organ which যেটা আমাদের হার্ট থেকে রক্তটা নিয়ে যায় সমস্ত ব্রেন থেকে শুরু করে কিডনি থেকে শুরু করে গাট থেকে শুরু করে পা থেকে শুরু করে সমস্ত জায়গায় রক্ত সাপ্লাই করে এওরটাটা। সুতরাং এওরটাতে যদি কোনো ডিজিজ থাকে সেটা ইজ নট কম্প্যাটেবল উইথ লাইফ, মানে ইট ইজ দ্যাট আর্জেন্ট। আই থিঙ্ক ডক্টর বাসি ভালো করে বুঝিয়েছেন যে কী কী সিচুয়েশনে সেটা খারাপ হয়ে যেতে পারে এবং সেটা হতে পারে, এবং যখন ওটা খারাপ হয় তখন ওটা ইমার্জেন্ট, ওটা খুব তাড়াতাড়ি ডিল করতে হয়। এই ডিলিং প্রসেসটাতে যেটা আমরা উই টক অ্যাবাউট শেকিং হ্যান্ডস হচ্ছে যে আমরা যেটা চিরকাল বুক কেটে কাজগুলো করতাম সেগুলো আজকাল ভেতর দিয়ে কিছুটা কাজ করা যায়। ইনফ্যাক্ট বেশিরভাগ পেশেন্ট, যেমন অতনু আর আমি যখন কাজ করি একসাথে, আমাদের একটা অ্যাওরটিক টিম আছে। সেই অ্যাওরটিক টিমের ইম্পর্টেন্সটা হচ্ছে দের ইজ ইউনো একটা পেশেন্টের জন্য কিছুটা সার্জিক্যালি কিছুটা এন্ডোভাস্কুলারলি করে গিয়ে পেশেন্টকে একটা বেস্ট রেজাল্ট দেওয়া যেতে পারে। এই কম্বিনেশন অফ ওয়ার্কিং টুগেদার ফর দ্য বেনিফিট অফ দ্য পেশেন্ট, এইটা ডক্টর দাস যেরকম বললেন সব জায়গাতে অ্যাভেলেবেল নেই। এটা একটা হায়ার স্পেশালিটি সেন্টারে যেখানে এক্সেপশনাল কোয়ালিটি ইমেজিং আছে, এক্সেপশনাল কোয়ালিটি ক্যাথ ল্যাবস আছে, এক্সেপশনাল কোয়ালিটি সার্জিক্যাল স্কিলস আছে, মানে ইন্টেন্সিভ কেয়ার ব্যাকআপ আছে। আমাদের এখানে অ্যাওরটিক টিমের আপনারা মাত্র 2-3জনকে দেখছেন, অ্যাকচুয়ালি দ্য অ্যাওরটিক টিম ইজ লট লার্জার। সেখানে পারফিউশনিস্ট আছে, সেখানে নার্সেস আছে, সেখানে ইন্টেন্সিভিস্ট আছে, অ্যানেস্থেটিস্ট আছে। ইটস এ বিগ প্রজেক্ট। এবং আমাদের প্রত্যেকটা পেশেন্ট যখন আসে, ইরেসপেক্টিভ অফ কার কাছে পেশেন্টটা আসছে, it is actually seen by the aortic team. So the patient actually gets 2 opinions or 3 opinions at the same time. And this is the key, that you work together for the benefit of the patient, because every patient's aorta and the problem is slightly different to the next patient. So therefore, which suits which patient is something that we can discuss as a team. So that is what we do provide in Narayana Health, and there are centers across the country that does it. One key message that should go out is that the service that is provided, the expertise that is provided is actually not much different to what is provided in rest of the country. So amader je typical, there is this approach, and there is a desire to go out of the city or out of the state to seek an opinion. That is fine, of course everybody is entitled to seek opinion, but to be honest, the facility and the expertise is available locally. So I find it difficult that a not so well off patient having to travel outside with the entire family. It is not conducive to good healthcare delivery. So I think one of the things that we as a group, or as all of us as doctors, would like to impart in this part of the country is to increase confidence in the people that actually these are available locally. And lastly, there are 2 more things I would like to say. One is about the cost. Unfortunately, our healthcare system is still not driven by no cost basis. The healthcare is not free at the point of delivery. So therefore, when a patient comes, like currently right now we have 2 or 3 patients that we are discussing, and the major impediment to delivering the right treatment is the cost. The devices are expensive, the procedures it takes a lot of hospital time, so they are not cheap. Now, I think press has also got a role in trying to inform the government that something needs to be done about how